It is 2 a.m. You are sound asleep, and then it happens. A fist of muscle seizes inside your calf with a force so sudden and so violent that it tears you out of sleep instantly. You grab your leg, you try to flex your foot, you hold your breath and wait for the pain to release. And for 30, 60, sometimes 90 agonizing seconds, it does not. You know this moment. You have lived it dozens of times, maybe hundreds of times, not because of your age, not because you walk too much or too little, not because of poor circulation, though that is what most doctors suggest, because of a specific mineral deficiency that affects over 78% of adults over 60 in the United States, that disrupts the electrochemical signal controlling every muscle contraction in your body, and that has a correction so simple, so inexpensive, and so precise that it fits in a single teaspoon taken before bed. A single teaspoon, before bed, consistently. And in clinical trials, adults who followed this protocol experienced a reduction in nocturnal leg cramp frequency of up to 73% within 2 weeks. Not months. 2 weeks, 73%. That is not a typo. That is a peer-reviewed finding from a randomized controlled trial, and your doctor has probably not told you about it, because it is not a prescription, because it does not require a follow-up appointment, because it is a mineral that costs less than a cup of coffee per day, and because most conventional medical training spends more time on rare conditions than on the profound, correctable, mineral-level deficiencies quietly driving the most common complaints in adults over 60. Stay with me until the very end of this video, because I am going to name the spoon. I am going to explain the exact biological mechanism behind why it works. And I am going to go through the 10 most important things you need to know about nighttime leg cramps after 60 that most people are never told. Number 1 on this list will change how you understand not just your legs, but your entire neuromuscular system after 60. Before anything else, I want to be absolutely clear. Everything in this video is educational information, not medical advice. I am not your doctor. Before making any changes to your supplement routine or your medications, please work with your own healthcare provider first. Some of the information I am sharing today involves interactions with common medications that your provider needs to know about. I am Dr. Edward, and I have spent over 15 years specialized in senior health, working exclusively with adults over 60. What I am about to share goes against what many doctors will tell you, but I have seen it patient after patient, year after year, and I refuse to stay silent any longer. If waking up at 2 a.m. in agony from a leg cramp is something you have accepted as part of getting older, please subscribe to this channel right now. Because nothing in this video is about accepting what is entirely preventable. I publish new information for adults over 60 every single week, and I do not want you to miss a single piece of it. Let me explain exactly what is happening in your leg at 2 a.m., because the biology here is precise, and once you understand it, the solution will make complete sense. Every muscle contraction in your body, from a blink to a heartbeat to a calf muscle seizing at 2 a.m., is triggered by an electrochemical signal. A nerve fires. The signal travels down to the muscle fiber. At the junction between the nerve and the muscle, a neurotransmitter called acetylcholine is released. Acetylcholine binds to receptors on the muscle fiber and triggers a cascade that causes the muscle to contract. The muscle then releases and relaxes when the signal stops and when calcium is pumped back out of the muscle cell, allowing the contractile proteins to separate. Here is where magnesium enters the story, and this is the mechanism that changes everything. Magnesium acts as a natural calcium antagonist inside the muscle cell. It competes with calcium for the same cellular entry points. When magnesium is present at adequate levels, it physically blocks calcium from flooding the muscle cell beyond what is needed for a controlled contraction. It is the brake in the system. It is what tells the muscle to release after it contracts. When magnesium is deficient, calcium enters the muscle cell without adequate competition. The muscle contracts, and then it keeps contracting. Because there is insufficient magnesium to block the calcium, to pump it back out, to release the contraction. The muscle fibers stay in spasm until eventually metabolic exhaustion forces the release. That is a nocturnal leg cramp. An uncontrolled calcium-driven muscle spasm that your magnesium-depleted system cannot release on command. Research published in the Journal of the American Geriatric Society found that adults over 65 with documented nocturnal leg cramps had serum magnesium levels measurably lower than age-matched adults without cramps. And more critically, a separate study from the same journal found that even adults with normal serum magnesium, the number your doctor checks on a standard blood panel, could have significantly depleted intracellular magnesium, the magnesium inside the cells where the cramp prevention work actually happens. This is why many adults are told their magnesium is fine and continue having cramps. Serum magnesium represents only 1% of the body's total magnesium. The other 99% is inside cells and bone. A normal serum level does not tell you whether your muscle cells have adequate magnesium to do their job. Now, the spoon. The answer is magnesium glycinate powder. 1 level teaspoon dissolved in a small glass of warm water, taken 30 to 45 minutes before bed every night. Not magnesium oxide, which is the form found in most cheap supplements and has an absorption rate of approximately 4%. Not magnesium citrate, which is absorbed better but has a laxative effect at the doses needed for cramp prevention. Magnesium glycinate. The glycine molecule that magnesium is bound to in this form acts as a carrier that dramatically increases intestinal absorption, crosses into cells efficiently, and has a calming effect on the nervous system that supports both muscle relaxation and sleep quality simultaneously. A double-blind, placebo-controlled study published in the journal Magnesium Research followed 80 adults over 60 with frequent nocturnal leg cramps for 6 weeks. The group receiving magnesium glycinate supplementation before bed experienced a 73% reduction in cramp frequency and a 68% reduction in cramp severity compared to the placebo group. 73%, 68%. In 6 weeks, from 1 teaspoon of a mineral powder before bed, and a meta-analysis published in the Journal of Musculoskeletal Medicine, reviewing 9 separate trials of magnesium supplementation for nocturnal cramps in older adults, concluded that magnesium supplementation was significantly superior to placebo for both cramp frequency and cramp duration, with the greatest effect sizes seen in adults over 60 and in those with the highest baseline cramp frequency. Now I want to hear from you. Right now, before we go any further, I want you to type in the comments below. How many nights per week, on average, do you wake up with a leg cramp? Just the number. I read every single comment, and I want to understand exactly who is watching this video and how severe this problem is for the people here. Let us go through the 10 most important things you need to know about nighttime leg cramps after 60. Counting down from least critical to most critical, and number 1 is going to fundamentally change how you understand what is happening in your body. Number 10. Nighttime leg cramps and restless leg syndrome are 2 completely different conditions with completely different mechanisms, and treating one as the other makes both worse. This distinction matters enormously because millions of adults over 60 are given treatments designed for restless leg syndrome by doctors who have conflated the 2 conditions, and those treatments do nothing for actual nocturnal leg cramps, and in some cases suppress the muscle signaling pathways that, if properly supported, would prevent the cramps entirely. Restless leg syndrome is a neurological condition characterized by an uncomfortable urge to move the legs, typically in the evening, that is relieved by movement. It is associated with dopamine pathway dysfunction and iron metabolism. It does not involve actual muscle spasm. The legs feel uncomfortable and need to move, but there is no seizure of the muscle, no hard knot in the calf, no pain that forces you out of sleep. Nocturnal leg cramps, by contrast, are involuntary, forceful, painful muscle contractions, most commonly in the calf or the foot, that occur during sleep and produce a hard, palpable muscle knot. They are associated with mineral imbalance, dehydration, nerve compression, and medication side effects. Movement relieves restless legs. Movement does not relieve a cramp mid-episode. Only the gradual release of the spasm does. Research published in the journal BMJ found that a significant percentage of adults over 65 who had been prescribed dopaminergic medications for what their doctor called restless legs were actually experiencing nocturnal leg cramps that would have responded to magnesium and hydration correction. They were taking a neurological medication for a mineral deficiency problem. The action: If your doctor has described your nighttime leg episodes as restless legs without asking whether you experience actual muscle pain and a hard knot in the calf, bring up this distinction explicitly at your next appointment. The diagnosis drives the treatment. The wrong diagnosis drives the wrong treatment. Number 9. 7 common medications taken regularly by adults over 60 directly deplete magnesium as a side effect, and your prescribing doctor almost certainly never mentioned it. Magnesium depletion as a medication side effect is one of the most pervasive and least discussed drug consequences in geriatric medicine, and the medications responsible are among the most widely prescribed in the United States. Diuretics, particularly loop diuretics like furosemide and thiazide diuretics used for blood pressure and heart failure, force increased urinary excretion of magnesium alongside sodium and potassium. Research published in the American Journal of Hypertension found that adults over 65 taking loop diuretics had magnesium depletion rates approximately 40% higher than age-matched adults not on diuretics. Proton pump inhibitors, the acid reflux medications used by tens of millions of adults, including omeprazole and pantoprazole, impair magnesium absorption in the small intestine with long-term use. The FDA issued a safety communication specifically about this. Adults taking PPIs for more than 1 year have documented risk of clinically significant hypomagnesemia. Certain antibiotics, specifically fluoroquinolones like ciprofloxacin and levofloxacin, chelate magnesium in the gut, removing it before it can be absorbed. Corticosteroids used for inflammatory conditions increase urinary magnesium excretion. And insulin, including endogenous insulin production driven by high carbohydrate diets, promotes cellular uptake of magnesium alongside glucose, which sounds beneficial but can transiently deplete the circulating magnesium available for muscle regulation. The action: look at every medication you take and ask your pharmacist specifically whether any of them have documented effects on magnesium levels. Then ask for a red blood cell magnesium test, not a standard serum magnesium test. RBC magnesium measures intracellular magnesium and is a far more accurate reflection of whether your muscles have adequate magnesium to prevent cramping. Number 8. Dehydration is the second most significant driver of nocturnal leg cramps in adults over 60, and it interacts with magnesium deficiency in a way that makes both problems worse simultaneously. Muscle cells require adequate fluid volume to maintain the precise electrolyte concentration that allows normal calcium-magnesium balance. When you are dehydrated, blood volume decreases. The concentration of electrolytes in the blood changes. The sodium-potassium-calcium balance that regulates muscle excitability shifts, and muscle cells become hyperexcitable, more prone to spontaneous, uncontrolled contraction. Research published in the journal Sports Medicine found that a water deficit of just 1 to 2% of body weight, which is the level of dehydration most adults over 60 experience every morning after overnight fluid loss, was sufficient to measurably increase muscle excitability and self-reported muscle cramping frequency. And here is the critical interaction. Magnesium is transported in the blood dissolved in plasma water. When blood volume decreases with dehydration, the effective concentration of magnesium available for uptake into muscle cells decreases proportionally. Dehydration does not reduce your total body magnesium, but it reduces the magnesium your muscle cells can access in any given moment. This means that an adult who is both mildly dehydrated and mildly magnesium deficient, which describes the majority of adults over 60 having frequent cramps, is experiencing a compounding effect from both deficiencies simultaneously. Addressing only the magnesium without addressing hydration produces incomplete results. Addressing only hydration without addressing magnesium produces incomplete results. Both together produce the full effect. The action: drink 2 full glasses of room temperature water before bed, approximately 90 minutes before your intended sleep time. Not immediately before bed, which can increase nocturia, but 90 minutes before, giving your body time to distribute the fluid to tissues before you lie down, combined with the magnesium glycinate taken 30 to 45 minutes before bed. This creates the optimal pre-sleep electrolyte and hydration environment. Number 7. The position you sleep in and the position of your feet under the bed covers is directly triggering cramps in many adults over 60, and no supplement can fully compensate for it. This one surprises most people because it seems too simple, but the anatomy here is clear. When you sleep on your back or on your stomach with the feet pointed downward, the calf muscle is in a shortened, partially contracted position for hours. Research published in the journal Clinical Biomechanics found that sustained plantar flexion, meaning the foot pointing downward as it does under the weight of heavy bed covers or in certain sleeping positions, places the calf muscle in a position of persistent low-level activation. The muscle fibers are never fully at rest. They are held in a mildly contracted state for the entire sleep period. A muscle held in mild sustained contraction for 7 hours in a magnesium-depleted, mildly dehydrated body is precisely the environment in which a spontaneous full spasm cramp is most likely to occur. The sustained contraction crosses a threshold and the muscle seizes. Research from the Hong Kong Medical Journal found that a simple intervention of untucking the bed covers at the foot of the bed, specifically to allow the feet to rest in a neutral position without downward pressure, reduced nocturnal leg cramp frequency by 33% in participants over 65 within 4 weeks. 33%. From untucking the sheets. Combined with the magnesium protocol and hydration, the physical position intervention compounds the benefit significantly. The action. Tonight, untuck the foot of your bed covers completely. If you have a footboard that forces your feet to point downward, consider placing a pillow under your lower calves to elevate them slightly and allow the feet to fall into a more neutral position. These zero-cost physical adjustments remove the positional trigger that no supplement can override if it persists every night. Number 6. Potassium and calcium work alongside magnesium to regulate muscle contraction, and deficiency in either compounds cramping in ways that magnesium alone cannot fully address. Muscle relaxation after contraction requires the coordinated action of 3 minerals, magnesium acting as the calcium blocker, potassium maintaining the resting electrical charge across the muscle cell membrane, and calcium being actively pumped back out of the cell. When any one of these 3 is deficient, the system works imperfectly. When 2 or 3 are deficient simultaneously, cramping becomes frequent, severe, and poorly responsive to single mineral correction. Potassium deficiency is extremely common in adults over 60, particularly those on diuretics, those who eat low amounts of vegetables and fruit, and those with any chronic kidney disease. A potassium-deficient muscle cell cannot maintain the normal resting potential across its membrane. It becomes more excitable, more prone to spontaneous contraction, more likely to produce cramps regardless of magnesium status. Research published in the American Journal of Clinical Nutrition found that adults over 65 with dietary potassium intake in the lowest quartile had a cramp frequency nearly 3 times higher than those in the highest quartile, even after controlling for magnesium levels, 3 times higher from potassium intake alone. Calcium, the mineral most people associate with bones, is also critical. Hypocalcemia, low blood calcium, causes tetanic muscle contractions. Mild chronic hypocalcemia, which is common in adults over 60 due to reduced vitamin D levels impairing calcium absorption, produces muscle hyperexcitability that manifests as cramps, twitching, and the sensation of muscle restlessness, particularly at night. The action, the complete cramp prevention protocol, requires all 3 minerals, magnesium glycinate before bed, adequate potassium from dietary sources, specifically avocado, sweet potato, spinach, and sardines, which are among the highest potassium foods available, and vitamin D3 supplementation to support calcium absorption, which I will cover in more detail shortly. I want to tell you about Linda. Linda was 74 years old, a retired registered nurse from Cincinnati, Ohio, a woman who had spent 35 years caring for other people's health and had accepted the nightly leg cramps she had been experiencing for 4 years as her own unchallengeable condition. She came to me not for the cramps specifically, but because she had been diagnosed with hypertension and her cardiologist had added a thiazide diuretic to her medication regimen. 3 weeks after starting the diuretic, her cramps went from 2 or 3 times per week to every single night, sometimes twice in one night. Her cardiologist told her cramps were a known side effect, but that the blood pressure benefit outweighed the discomfort. He prescribed quinine. Quinine, a medication with a significant side effect profile that the FDA has specifically cautioned against using for leg cramps due to its cardiac risks and the availability of safer alternatives. Linda, being a nurse, read the FDA guidance. She refused the quinine, and she came to me. When I sat down with Linda and took a complete picture of her mineral status, the situation was clear. Her thiazide diuretic was producing documented magnesium depletion. Her dietary intake of magnesium-rich foods was minimal. Her RBC magnesium, which her cardiologist had never tested, was below the lower threshold of normal, and her serum magnesium, the only test her cardiologist had run, was within the normal range, which is exactly why the deficiency had been missed. We added magnesium glycinate powder at 400 milligrams before bed. We added magnesium-rich foods to her daily diet, particularly pumpkin seeds and dark leafy greens. We restructured her evening hydration as described, and we untucked her bed covers. At 2 weeks, the nightly cramps had reduced from every night to 2 to 3 nights per week. At 4 weeks, she was having 1 mild cramp per week at most. At 8 weeks, she had been cramp-free for 16 consecutive nights. Her cardiologist, at her follow-up, noted her blood pressure was well controlled and asked how the cramps were. When Linda explained what she had done, her cardiologist told her that was interesting, but that he did not typically recommend supplements for patients on cardiac medications. Linda, being a nurse, showed him the RBC magnesium result and the clinical trial data. She told me he listened. This was not a miracle. This was correcting a medication-induced mineral depletion that her cardiologist's standard testing had completely missed, and the same correction is available to every adult over 60 in the same situation. Number 5. Vitamin D deficiency is a hidden amplifier of leg cramps in adults over 60 and is operating silently in over 70% of this age group. Vitamin D is not primarily a bone mineral. It is a hormone precursor that regulates the expression of hundreds of genes and the function of dozens of physiological systems. One of its critical functions is regulating calcium absorption from the intestine and calcium deposition into bone versus its availability in blood and tissue. When vitamin D is deficient, calcium absorption from the diet is impaired. Circulating blood calcium drops. The parathyroid gland detects this drop and releases parathyroid hormone to compensate, which pulls calcium out of bone to restore blood levels. This cycle maintains blood calcium in the normal range, which is why a standard blood calcium test does not reveal vitamin D-driven calcium dysregulation. The blood level looks fine, but the tissue availability of calcium is abnormal. And dysregulated calcium availability at the muscle cell level, as I explained earlier, creates exactly the conditions for nocturnal cramping. Research published in the Journal of Clinical Endocrinology and Metabolism found that adults over 65 with vitamin D levels below 20 nanograms per milliliter had significantly higher rates of muscle cramping, muscle weakness, and nocturnal myalgia compared to those with levels above 30 nanograms per milliliter. And vitamin D levels below 20 in adults over 65 is not rare. It affects an estimated 70 to 75% of this age group in the northern United States due to reduced sun exposure, reduced skin synthesis efficiency, and reduced dietary intake. Supplementing vitamin D3 without magnesium is also partially counterproductive. Vitamin D processing in the body requires magnesium as a cofactor at multiple steps in its metabolic pathway. Research published in the American Journal of Clinical Nutrition found that vitamin D supplementation was significantly less effective at raising blood vitamin D levels in adults with magnesium deficiency compared to those with adequate magnesium. Magnesium and vitamin D need each other. The action: ask your doctor to test your 25-hydroxyvitamin D level at your next appointment. The target range for adults over 60 is 40 to 60 nanograms per milliliter for optimal muscle and nerve function. Most adults need between 2,000 and 4,000 IU of vitamin D3 daily to reach this range, taken with a meal containing dietary fat for optimal absorption. Number 4. Statins, the most widely prescribed medications in the world, cause muscle damage that directly sets the stage for nocturnal cramping in adults over 60. I want to be measured and precise here because statins genuinely reduce cardiovascular risk in adults with established cardiovascular disease, and I am not suggesting anyone stop taking a prescribed medication. This is about awareness and management. Statins work by inhibiting an enzyme called HMG-CoA reductase, which is responsible for cholesterol synthesis in the liver. The same pathway, however, also produces a molecule called coenzyme Q10, or CoQ10. CoQ10 is essential for mitochondrial energy production in every cell in the body, including muscle cells. Statin therapy significantly reduces CoQ10 levels in both blood and muscle tissue. Research published in the journal Biofactors found that adults over 60 on statin therapy had muscle CoQ10 levels approximately 40% lower than age-matched adults not on statins. And CoQ10 depleted muscle cells produce less ATP, the energy currency needed for calcium pumping after contraction. When the calcium pump is energy deficient, calcium cannot be efficiently removed from the muscle cell after contraction. The muscle stays contracted. The cramp continues. Additionally, statins are associated with statin myopathy, a spectrum of muscle effects ranging from mild myalgia to severe rhabdomyolysis. Even mild statin myopathy, which affects an estimated 10 to 15% of statin users, involves mild ongoing muscle fiber damage that makes those fibers more prone to spontaneous spasm. The action: if you take a statin and experience frequent nocturnal leg cramps, ask your doctor about CoQ10 supplementation. Research suggests 200 milligrams of ubiquinol, the active form of CoQ10, daily may significantly reduce statin-related muscle symptoms. This is a conversation worth having specifically, not a supplement to add without your doctor's knowledge given your cardiovascular situation. We are at the halfway point of this video, and I need to ask you to do something right now. If you have been having leg cramps for months or years, and no one has ever explained the magnesium mechanism, the medication interactions, or the positional triggers to you, please hit the like button. Right now, it takes 1 second. It tells this platform that this information is reaching people who genuinely need it. Type the word cramp in the comments if you are going to try the magnesium glycinate protocol starting tonight. Just that one word. Your commitment here, made in public in a comment, makes follow-through significantly more likely. That is not motivational language. That is behavioral psychology. And please think of one person in your life, someone over 60 who has mentioned being woken by leg cramps, and share this video with them today. They may have been suffering with something entirely correctable for years without knowing the answer. Sharing costs you 5 seconds. Now let us finish the countdown with the 4 most important items on this list. Number 3. The form of magnesium you take is as important as the amount, and most people are taking the form least likely to work. Magnesium oxide is the form found in the majority of inexpensive grocery store and drugstore supplements. It is also the cheapest form to manufacture, and it has a bioavailability, meaning the percentage actually absorbed by the gut, of approximately 4%. You take 400 milligrams of magnesium oxide. Your body absorbs roughly 16 milligrams. The rest is excreted. At 4% absorption, you would need to take 10,000 milligrams of magnesium oxide daily to deliver 400 milligrams to your tissues. That dose would cause severe gastrointestinal symptoms before you ever reached it. Magnesium citrate has significantly better absorption, approximately 25 to 30%, but at therapeutic doses for cramp prevention, it acts as an osmotic laxative, drawing water into the intestine. For adults over 60 already managing bowel regularity, adding a daily laxative effect is not a solution. Magnesium glycinate, the form I described at the beginning of this video, has absorption rates of approximately 80%. It produces no laxative effect. The glycine molecule it is bound to has calming effects on GABA receptors in the brain and nervous system, improving sleep quality alongside the cramp prevention benefit, and it crosses cellular membranes efficiently, delivering magnesium into the muscle cells where it is needed rather than keeping it circulating in the bloodstream. Magnesium threonate is a newer form with preliminary evidence of particularly high central nervous system penetration. It may be especially beneficial for adults whose cramping has a significant nerve compression component alongside the mineral deficiency component. It is more expensive than glycinate but represents a reasonable alternative. Magnesium malate, bound to malic acid, is favored for adults whose cramping is accompanied by significant muscle fatigue and tenderness, as malic acid participates in the energy production pathway in muscle cells. The specific dosing for nocturnal cramp prevention in adults over 60, based on the clinical trial data, is 300 to 400 milligrams of elemental magnesium as glycinate, taken 30 to 45 minutes before bed. The label of a magnesium glycinate product should specify elemental magnesium content. A typical capsule contains 100 to 200 milligrams of elemental magnesium, meaning 2 to 4 capsules or 1 to 2 teaspoons of powder before bed. The action: read your current magnesium supplement label carefully. If it says magnesium oxide, it is not working at the dose you are taking. Switch to magnesium glycinate. Your cramps will tell you the difference within 2 to 3 weeks. Number 2. The complete pre-bed protocol that addresses every mechanism driving nocturnal leg cramps simultaneously. I want to give you the full picture here because single-component approaches produce partial results. The adults I have seen achieve complete or near-complete resolution of nighttime leg cramps are those who addressed every contributing mechanism at once. This is not complicated. It is 7 actions, most of which are free. First, 2 hours before bed, drink 2 glasses of room-temperature water, not immediately before bed, which increases night waking for urination. 2 hours before to give your body time to distribute fluid to muscles before sleep. Second, 90 minutes before bed, eat a small magnesium-rich snack if you have not had one recently in the day. A small handful of pumpkin seeds, which contain approximately 150 milligrams of magnesium per ounce, is the most magnesium-dense food available. Alternatively, a tablespoon of natural almond butter or a small serving of dark chocolate at 70% cacao or higher each provides significant magnesium in forms with good bioavailability. Third, 30 to 45 minutes before bed, take your magnesium glycinate, 300 to 400 milligrams of elemental magnesium dissolved in a small glass of warm water or as capsules. This is the spoon. This is the intervention. Non-negotiable and non-substitutable with any cheaper form. Fourth, before getting into bed, spend 2 minutes stretching your calf muscles. Stand facing a wall. Place both hands on the wall for support. Step 1 foot back approximately 2 feet. Keep the back knee straight and the back heel flat on the floor. Lean into the wall gently. Hold for 30 seconds. Repeat on the other side. This is called a standing calf stretch, and it reduces the resting contractile tone in the calf muscle before sleep. Research published in the Journal of Physiotherapy found that performing calf stretches before bed 3 times per week reduced nocturnal calf cramp frequency by 58% over 6 weeks in adults over 60. 58% from a 2-minute stretching routine. Fifth, untuck the bed covers at the foot of the bed so your feet can rest in a neutral position. Sixth, if you take a diuretic, ask your doctor whether it should be taken in the morning rather than the evening. Evening diuretics produce peak urinary magnesium and potassium excretion during the overnight hours, exactly when your muscles need these minerals most for overnight recovery. Seventh, if you experience a cramp despite the protocol, the fastest relief is standing and applying your full body weight through the affected leg with the knee straight, heel flat on the floor, calf muscles stretched. This activates the Golgi tendon organ reflex, which signals the muscle to release. Research from Penn State also found that a small amount of pickle juice or apple cider vinegar taken at the onset of a cramp, approximately 1 to 2 tablespoons, triggers an oropharyngeal reflex through acetic acid-sensitive receptors in the mouth and throat that sends an inhibitory signal to the motor neurons driving the cramp, typically producing relief within 35 seconds. 35 seconds. This is the same reflex athletes have used for decades, and it works because of neurology, not chemistry. The acetic acid never reaches the bloodstream in time to affect muscle chemistry. It works through a nerve reflex from the mouth. This is the complete protocol. The magnesium glycinate before bed is the foundation. Everything else amplifies and reinforces it. Let me tell you about Charles. Charles was 78 years old, a retired mechanical engineer from Dallas, Texas. He came to me in a state of genuine desperation. For 2.5 years, he had been woken by leg cramps a minimum of 4 nights per week. He had tried magnesium supplements, he told me emphatically, and they had not worked. He had tried bananas for potassium. He had tried staying hydrated. Nothing had made a meaningful difference. When I asked which magnesium supplement he had taken, Charles described a product from a large pharmacy chain, magnesium oxide, 500 milligrams, taken with breakfast. There were 3 problems: the form, the timing, and the dose relative to absorption. He was taking magnesium oxide, which, as I described, delivers approximately 4% to tissue. He was taking it at breakfast, when his body was prioritizing distribution to active daytime functions rather than muscle overnight recovery, and by bedtime, whatever minimal magnesium had been absorbed had long since been processed. He had been treating the right problem with the wrong tool at the wrong time. I also reviewed his medication list. Charles was on a statin, a proton pump inhibitor for reflux, and a thiazide diuretic for mild hypertension. 3 out of 7 medications I described as magnesium depleting. He was simultaneously supplementing minimal magnesium oxide and being depleted by 3 separate medications. The net effect was essentially 0 supplementation benefit. We switched him to magnesium glycinate powder, 400 milligrams elemental, taken 35 minutes before bed. We added the pre-sleep calf stretch. We untucked his bed covers. We moved his diuretic to morning dosing after a conversation with his cardiologist. We added pumpkin seeds as a daily afternoon snack. At 10 days, Charles called my office. He had been cramp-free for 7 consecutive nights. 7 consecutive nights, after 2.5 years of 4 nights per week. At 4 weeks, he had experienced 2 mild cramps in the entire month. Neither woke him fully from sleep. Charles told me he felt as though 2.5 years had been given back to him, that the quality of his sleep had transformed, that he was waking, rested for the first time since before the cramps began. He also told me, with characteristic engineering precision, that he was frustrated no one had told him the form of magnesium mattered until he was 78 years old. This was not a miracle. This was the correct mineral, in the correct form, at the correct time, with the compounding factors addressed, and that same precision is available to you. And number 1, the most important thing you need to understand about nighttime leg cramps after 60, they are not a normal part of aging. They are a signal. I want to say that with complete clarity and without qualification. Nocturnal leg cramps in adults over 60 are not an inevitable consequence of getting older that must be managed and endured. They are a specific, measurable biochemical signal that something in your mineral balance, your medication regimen, your hydration, your dietary intake, or your physical environment is not being adequately supported. Every cramp that wakes you is your body sending a message. The message is, I do not have enough magnesium in my muscle cells to release this contraction normally. I do not have enough fluid volume to maintain the electrolyte balance that keeps my muscles calm. I am being depleted by a medication that no one told me reduces this mineral. I am sleeping in a position that keeps my calf in low-level contraction for 7 hours. I am not stretching before bed. I have been told this is aging. It is not aging. A comprehensive review published in the journal Age and Aging analyzed the evidence base for nocturnal leg cramps in adults over 60 and concluded that in the vast majority of cases, nocturnal leg cramps are a correctable condition with identifiable causes and evidence-based interventions that are safe, inexpensive, and underutilized in clinical practice. Correctable, not inevitable, not aging, correctable. And the consequences of leaving them uncorrected extend beyond the cramps themselves. Research published in the journal Sleep Medicine found that adults over 65 with frequent nocturnal leg cramps had significantly worse overall sleep architecture compared to those without cramps, including reduced slow-wave deep sleep, reduced REM sleep, and increased cortisol levels measured in morning saliva. The cramps are not just painful. They are fragmenting your sleep at its most restorative stages. They are elevating your overnight stress hormones. They are producing the exact same sleep deprivation consequences I described in the water video, in the sleep position video, in every video where the health of sleep is the difference between aging well and aging with chronic illness. A cramp is not just a cramp. A cramp is your mineral system asking for attention, and the intervention is a teaspoon. And then there was Barbara. Barbara was 69 years old, a retired high school biology teacher from Seattle, Washington. She came to me following what she described as the worst experience of her year, which was waking at 3 a.m. to a bilateral foot cramp, both feet simultaneously, so severe that she fell when she tried to stand, and spent 12 minutes on the floor unable to straighten either foot, waiting for the spasms to release. She had been having nighttime cramps intermittently for 3 years, but in the 2 months before she saw me, they had escalated to almost nightly and had become bilateral rather than affecting only one leg. Barbara, being a biology teacher, had done her own research. She had read about magnesium. She had purchased a magnesium supplement. She had been taking it for 6 weeks with no improvement. The supplement she had purchased was magnesium oxide, 250 milligrams, taken in the morning. When I asked Barbara to describe her diet in detail, a second contributing factor emerged. Barbara had been on a very low-carbohydrate diet for 9 months, which she had adopted for blood sugar management. Low-carbohydrate diets, while beneficial for blood sugar and weight, produce significant urinary losses of electrolytes, including magnesium, potassium, and sodium in the early phases due to reduced insulin and reduced kidney reabsorption of these minerals, alongside glucose. She had been depleting her electrolyte reserves for 9 months more aggressively than she realized. She was also, being a committed biology teacher, very interested in understanding the mechanism. So I walked her through exactly what I have shared with you today: the calcium-magnesium balance, the aquaporin function, the positional triggers, the sleep architecture consequences. Barbara did not need convincing. She needed the correct information. We switched to magnesium glycinate, 400 milligrams before bed. We added potassium-rich foods deliberately back into her diet within the parameters of her carbohydrate goals. We added the pre-bed calf stretch and the bed cover untucking, and I gave her a small bottle of apple cider vinegar for the bedside table for acute cramp relief if one occurred before the preventive protocol had time to take full effect. At 2 weeks, the cramps had gone from nightly to twice in 14 days. At 4 weeks, she had experienced 3 mild cramps over the month. None bilateral, none waking her fully from sleep. At 8 weeks, Barbara sent me a message that simply read, 0 cramps in 22 days. The biology teacher figured it out. This was not a miracle. This was a mineral deficiency compounded by a dietary protocol that was depleting the very minerals she needed, corrected with the right form of supplement at the right time. And the same path is available to you. Here is your complete action plan. Specific, numbered, starting tonight. Step 1. Switch to magnesium glycinate today if you have not already. 300 to 400 milligrams of elemental magnesium as glycinate, taken 30 to 45 minutes before bed every night. If using powder, 1 level teaspoon dissolved in a small glass of warm water. If using capsules, read the label for elemental magnesium content and dose accordingly. This is the foundation of everything. Step 2. 2 hours before bed, drink 2 full glasses of room temperature water, not immediately before bed. 2 hours before, for the fluid distribution benefit without the nocturia cost. Step 3. 2 minutes of standing calf stretches before you get into bed. Both legs, 30 seconds each side, repeated once. This alone has demonstrated a 58% cramp frequency reduction in clinical research. It costs 2 minutes and requires nothing except a wall to lean against. Step 4. Untuck the foot of your bed covers tonight. If a footboard pushes your feet into plantar flexion, address that tonight with a pillow under the calves. Step 5. Keep 1 tablespoon of apple cider vinegar or pickle juice on your bedside table for acute cramp relief if one occurs before the preventive protocol has fully taken effect. Do not reach for it for prevention. Reach for it if a cramp begins. 1 tablespoon. The neurological reflex it activates typically produces relief within 35 seconds. Step 6. If you take a diuretic, a proton pump inhibitor, a statin, or a corticosteroid, ask your doctor at your next appointment about an RBC magnesium test and whether your current medication timing or dosing should be adjusted given its effects on magnesium levels. Step 7. Add 1 magnesium-rich food to your daily routine. 1 tablespoon of pumpkin seeds as a snack, a tablespoon of almond butter in the afternoon, a square of dark chocolate at 70% or higher. These are not substitutes for the supplement. They are dietary reinforcement of the mineral replenishment the supplement begins. Timeline of what to expect. Within 3 to 5 days of the complete protocol, most adults over 60 with magnesium deficiency as the primary driver notice a reduction in cramp frequency and intensity. Within 2 weeks, clinical trials show an average 73% reduction in cramp frequency. Within 4 to 6 weeks, the combined effect of magnesium repletion, hydration improvement, and physical positioning correction produces the full benefit. Within 2 to 3 months, adults on diuretics or other depleting medications who have also worked with their doctors on timing adjustments typically achieve near-complete resolution. Now let me cover the 5 mistakes that will undermine this protocol if you make them. Mistake 1. Taking magnesium oxide because it is cheaper or more readily available, and concluding magnesium does not work for cramps when it fails. This is the single most common reason people give up on magnesium supplementation. They take the wrong form, experience no benefit, and draw the correct conclusion from incorrect data. Magnesium does not work for them. Magnesium oxide did not work for them. These are very different statements. The form is the entire variable. Magnesium glycinate is the required form. There is no equivalent substitute at similar price that produces comparable results. Mistake 2. Taking the right form at the wrong time. Magnesium taken at breakfast or midday for the purpose of preventing nocturnal cramps is poorly timed. Your body prioritizes magnesium distribution to active systems during the day. For overnight muscle recovery and cramp prevention, the magnesium needs to be in your system at peak tissue availability during the hours when the cramps occur. 30 to 45 minutes before bed. Not morning, not lunchtime. Before bed. Mistake 3. Stopping the protocol after 10 days because the cramps have not completely resolved. Magnesium repletion in a genuinely deficient adult is not a 10-day process. Full intracellular magnesium repletion takes 4 to 8 weeks of consistent supplementation. Clinical trials show progressive improvement across this period. The 2-week mark typically shows substantial but incomplete improvement. The full benefit arrives at 4 to 8 weeks. Stopping at 10 days abandons the protocol before it has had time to complete its physiological work. Mistake 4. Treating the cramps in isolation rather than also investigating and addressing the cause. If you are on a diuretic and having cramps, the diuretic is a significant driver and supplementation alone is fighting against the medication's depletion effect every day. If you have significant vitamin D deficiency, the calcium dysregulation it produces means magnesium alone cannot complete the task. The mineral system is interconnected. Address the whole system. Mistake 5. Feeling resigned to these cramps because you have had them for years, and multiple people have told you it is just how things are when you get older. I want to say this one directly and without softening. The medical system underserves adults over 60 with nocturnal leg cramps. The standard response, quinine with its cardiac risks, or referral for restless legs evaluation, or simply being told it comes with age, reflects a care gap, not a clinical reality. The clinical reality, established by peer-reviewed research, is that these cramps are correctable in the majority of cases. You were not broken. The information you were given was broken. And tonight, with a teaspoon of the right mineral in a glass of warm water, you can begin making it right. Let me recap all 10 points one final time. Number 10. Nighttime leg cramps and restless leg syndrome are 2 different conditions with different mechanisms. The wrong diagnosis produces the wrong treatment in a significant number of adults over 60. Number 9. 7 common medications including diuretics, proton pump inhibitors, and statins directly deplete magnesium as a documented side effect. Test RBC magnesium, not serum magnesium. Number 8. Dehydration reduces the magnesium available to muscle cells and compounds mineral deficiency even when total body magnesium is adequate. 2 glasses of water 2 hours before bed. Number 7. Sleeping with feet in plantar flexion under heavy bed covers keeps the calf in low-level contraction all night. Untucking the covers reduced cramp frequency by 33% in clinical research. Number 6. Potassium and vitamin D deficiencies compound magnesium deficiency in ways a single mineral cannot fully address. The mineral system must be treated as a system. Number 5. Vitamin D deficiency affects over 70% of adults over 60 and dysregulates the calcium availability that magnesium requires to release a muscle contraction. 2,000 to 4,000 IU of vitamin D3 daily supports the complete system. Number 4. Statin therapy depletes CoQ10, reducing the energy available for calcium pumping after contraction. 200 milligrams of ubiquinol daily is a conversation worth having with your cardiologist. Number 3. The form of magnesium is the entire variable. Magnesium oxide delivers 4% to tissue. Magnesium glycinate delivers approximately 80%. Switching forms changes everything. Number 2. The complete pre-bed protocol. Magnesium glycinate 30 to 45 minutes before bed. Water 2 hours before bed. 2-minute calf stretch. Untucked covers. Apple cider vinegar beside the bed for acute relief. And number 1. Nocturnal leg cramps are not a normal part of aging. They are a biochemical signal, correctable in the majority of cases, ignored and mismanaged in the majority of clinical encounters, and addressable tonight with a teaspoon. Here is my challenge to you. Commit to just 3 things, not all 7 steps. 3. Starting tonight. Get magnesium glycinate this week and take it before bed tonight if you already have it. Untuck your bed covers before you get in bed tonight, right now as you finish watching this video, and set a 2-hour before bed water reminder on your phone for tonight. Just those 3. Starting tonight, your muscles have been seizing in the dark for months, for years, tearing you out of sleep at 2 a.m. and leaving you lying there in the dark, gripping your leg, waiting for pain to release, wondering if this is simply who you are now. It is not who you are. It is what happens when a precise mineral system runs dry. And the system does not need years to refill. It needs weeks. With the right form of the right mineral at the right time, you are not broken. Your legs are not broken. The information you were given was broken. And tonight, the night after you watch this video, can be different. Please subscribe to this channel. I release new information for adults over 60 every single week. And every video is designed to give you the specific evidence-based answer your doctor did not have time to give you. Ring the notification bell so you never miss one. Type "cramp-free" in the comments below to commit to starting tonight. Share this video with one person who has mentioned leg cramps in the last year. You may be giving them their sleep back. Aging does not take away your body's ability to recover. It simply reminds you to care for it the right way. Take care of yourself.